now is Dr. Joseph Blackmon from PaducahDermatology. And Dr. Blackmon, we've been working through skin care. We've talked about cleaning our face. We've talked about retinol and other things to help those fine lines. So now let's dive into Botox and fillers.
Okay.
All right, so our people want to know who's a candidate for Botox or fillers.
Okay, well, we could kind of maybe start with Botox first. We all know it. It is a brand name. There are a lot of different other types that are out there with different names, but we all kind of know it as a household name of Botox. And when we look at Botox and who is a good candidate, there's really a broad spectrum of candidates. So from early age prevention, so we're talking into our maybe late 20s, 30s, where the small little fine lines aren't really creeping up just yet, but you want to try to prevent that from even happening. All the way into our 70s, our 80s. So we have really a broad range of patients who are candidates. And so it's really whatever they're desiring and whatever they want. Typically there are a few things, like if you're pregnant, if you have some medical diseases, myasthenia gravis, a few other things you'll definitely want. We'll kind of pre-screen you to make sure those would be people who aren't candidates at that time for it. But something that we can definitely look at. So it's good for the fine lines, and then we can kind of get into some of the filler stuff as well.
Okay, so how does that treatment work? What's that look like?
So so both of these are needles. So if you're needle phobic, just you know, something just to consider. But we do try to, a lot of the fillers now, a lot of the different brands have a little bit of lidocaine in there, so it has anesthesia, so that kind of helps offset some of the pain once it's injected. But really, I think the whole paradigm shift over the last few decades has been, you know, where we used to inject, and we still do inject fillers, you know, around the lips, the perioral areas where we get the little lines, even here, these you know, melolabial folds here. But really the idea is that we're wanting to lift and put in filler deep here in the cheek. So gravity, you know, mother time, it's just not our friend. So a lot of that skin will start to just start to creep down. And so we want to kind of lift up from here. And so when we lift up from here, we're actually getting rid of a lot of these lines here that start to accentuate, a lot of these lines that start to accentuate. So instead of where we used to, the old school thought was we would go right into those areas. Now we're just kind of lifting here, kind of focusing more higher up. And then it's helping giving and achieving an overall aesthetic looking look.
Makes sense instead of just filling it in.
Yeah.
So
we still do that sometimes too, though. For lips and other things, we
Different
definitely do. We'll do the direct injections.
Okay.
Sure.
Any side effects?
Really, not really. I mean, if you know, sometimes if you are you know, allergic to it, sometimes you'll have a reaction. We'll want to know about that. There's always risks that are involved with it. And those are things that we'll go over during the pre-consultation, so pre-procedure consultation. So just something to consider.
Perfect.
Yeah.
Thank you for your information today.
Yeah,
I'm so glad you joined us.
Yeah.
If you would like to revisit this segment with Dr. Blackmon from PaducahDermatology, log on to WPSDLocal6.com/familyhealthexperts.
Northbound